Yo, this is a continuation of my video, I Went to Hospital. Although I had a terrible time at hospital, I'm glad I had health insurance. I cannot imagine how much it would cost without it. After getting home from hospital on July 23rd, 2021 from my kidney stone removal surgery, I noticed some things. Namely, some bruising down both arms, a bruise around the incision site, and a giant bruise on my back. My testicles had turned completely coal black, and from 9 days after surgery, I was rendered completely asexual. I had a bad cough and occasionally blew blood from my nose. That's in addition to urinating dark red blood for the first few days. Then it became regular colored urine. From July 23rd to August 1st, I had great pain on a regular basis. I was prescribed an antibiotic pill, a pill for bladder spasms, extra strength Tylenol, that's acetaminophen, and a pill containing a narcotic, but at such a low percentage it was barely stronger than the Tylenol. A little bit, bit stronger. The pain was largely managed because of the medicine. That is, when I was in bed. Getting out of bed resulted in a ripping pain, so I would carefully maneuver myself up each time. And it was difficult to walk since with each step I would have a stabbing pain in my midsection. So I would hold my abdomen whenever I would walk around the house. I also felt lightheaded and that I was somewhat unable to think, probably due to the blood loss. And I basically did nothing more than lie in bed for around 9 days. My sleep disorder was worse than usual, so I took a pill to facilitate sleep every day or night. I had no bowel movement for the first few days, no doubt mainly due to the fact that I hardly ate. Then I had one good bowel movement. But for a few days hence, my bowels blasted liquidy orange poop of their own accord, which made some big messes. Outside of the pain, everything else returned to normal by around August 2nd. That's the day I went in to get my stent removed. My particular stent was a tube connecting my kidney to my urethra in order to help facilitate the removal of any residual contaminants. After going in, a Hispanic female nurse washed my penis with disinfectant liquid soap. Then the surgeon came in and produced an unusual metal instrument. With the nurse's guidance, the physician jammed the instrument into my penis, which caused great pain. But the instrument pulled out the entire stent in around 30 seconds, and the procedure was over. I then had an appointment set to check on my kidney in 8 weeks. Now, here is what we should know about hospitals and surgery. 1. Some believe that members of their religion should never seek or receive medical care for any condition, and that prayer and other spiritual practices can substitute for medical treatment. This can be dangerous nonsense if you or your child need treatment. Luke, a prominent disciple of Christ who wrote scriptures, the Gospel according to Luke, and the Acts of the Apostles, was a medical doctor. Colossians 4:14. Instead, necessary medical treatment, including blood transfusions and transplants if needed, should be coupled with prayer and other spiritual practices. 2. However, hospitals should be avoided if at all possible. The reasons are that the primary goal of hospital staff is to make money, not cure or mend people. Many hospitals, upon finding that a potential patient has no means to pay, will refuse treatment even if it means that the person will suffer and die. Truly altruistic Florence Nightingale types are very rare. Secondly, as long as you are in the hospital, staff will do everything to try to control you and you'll get absolutely nothing done. Then there's medical error, such as operating on wrong body parts, giving wrong medicines, leaving instruments inside patients, etc. Even with correct surgery, patients have had heart attacks, strokes, and have died just because of surgery trauma. Then there are diseases people catch after entering hospital, since hospitals harbor diseases, since that's where very sick people congregate. Ray, a former high school classmate of mine, went for kidney surgery, but he suffered an ocular stroke from it, which made him nearly blind and permanently so. He also caught the coronavirus at the hospital. There have even been predatory hospital staff who purposely murdered people, such as Dr. Harold Shipman and nurse Rita Mays. Regardless, it will cost lots of money since insurance does not pay everything. You are responsible for the copay. Although everyone should have medical insurance, since you can become bankrupt without it. And everyone should do whatever they possibly can to prevent the necessity of going into the hospital to begin with. For example, live a life free from risky behavior. Another plan should be to be healthy. I'm overweight, have not been exercising, and have avoided eating fruit. This likely contributed to having a kidney stone. Many people in the time before modern medicine never had to go to the hospital in their life, even living into very old age. But they undoubtedly avoided every type of risky behavior on a consistent basis and worked toward maintaining optimal health. Think about these things.